Good afternoon, everyone, and welcome to Introduction to Employee Benefits for Busy Executives. I'm your host, Donovan Pyle from Health Compass Consulting. Thank you for joining. Great. Well, let's dive right in. So we got to put a warning right at the top of this because the things that we're going to show you today are going to make you look at this employee benefits industry in a completely new way. So we're not going to talk about any of the normal things that you usually are bored to death with when you talk about employee benefits. We're not going to talk about co-pays. We're not going to talk about deductibles. We're not going to talk about wellness. We're not going to talk about any of that stuff because that stuff is mostly irrelevant. It's a downstream problem. We're going to focus on the fundamental things that actually drive the end results. So everyone here could just sign the waiver, and we'll dive right in. Okay, so quick introduction. My name is Donovan Pyle. I'm the CEO and founder of Health Compass. Health Compass is a new kind of professional services company founded in 2018, and we are actively chipping away at the $300 billion a year that employers waste and overpay on healthcare and benefits every single year. Other than that, I chair the Validation Institute's Certified Health Value Professional designation, their advisory board. And the mission there is to really help elevate the professional standards and knowledge of the benefits consulting industry by providing the leading education on health plan innovation. Because as we know, benefits professionals that don't really have a deep expertise in this area are more likely to create risk than manage it. All right, and just some certifications here. Some of you may not be aware, but a lot of you are probably are actually fiduciaries for your plans, whether you know that or not. So basically, if you have discretionary authority over your health plans, if you're a decision maker, you are generally considered a fiduciary on your plan. So if you're not an expert in healthcare financing and procurement, you're required under federal law to hire someone who is. So one of the ways that you can identify one in the wild is through certifications and designations. So you want to look for these kinds of things. All right, let's begin. So why does this topic matter? We're all living in a world of tightening capital markets, despite the Fed loosening things up, supposedly, I think today, tightening labor markets, and rising operating expenses. So, healthcare has become an increasing concern. And, according to PwC's latest report, they're expecting the highest increase on healthcare costs in 13 years occurring next year in 2025. So this presentation is very timely because, as we know, healthcare is often an organization's top 3 expense, usually the fastest growing financial risk on the P&L. This matters. All right, so let's just take a step back and think about first principles, why do we even offer benefits in the first place? And yes, some of you say, well, geez, because I have to under federal law, blah, blah, blah. But yeah, you were doing it before you had to. And you did it because of the tax advantages. This is the whole reason this whole industry got started, was because of tax advantages coming out of WW2. We don't need a history lesson, but basically, on average, $1 invested in benefits equals $1.12 in wages. So if you are really thoughtful and mindful about how you structure your benefits and what they're trying to achieve, then you can really take advantage of this. If you don't have someone really acting as an architect for your program, then you're likely not really getting the return on the investment that you deserve. All right, so at a very basic level, what is a benefits package as far as health and welfare plans goes? Well, you've got your health insurance, your health plan, your dental, your vision, your life insurance, disability. This is table stakes in 2024. Of course, you can iterate endlessly beyond that, but this is what we're talking about. All right, so how do we actually get these benefits in place? What does the actual supply chain look like? Well, the first thing in your supply chain for most companies is their broker, right? 81% of companies use a benefits broker, and benefits brokers go to insurance companies. And then the insurance companies set up contracts with the actual healthcare providers, right? So this is the supply chain in very broad strokes. You have to go through all of this right now. This is what most companies do to get what they actually want, which is healthcare for their employees. All right, so here's something that's kind of shocking. I'm going to guess that most people on the call are not driving something like this. And we don't drive cars like this for the most part because we have better cars now. And so what's really interesting though is that most of the health plans, we've seen innovation in so many other areas of our economy, but most of the health plans that a lot of employers use today were actually developed in the 1990s. They haven't really iterated a whole much despite there being a very dynamic marketplace out there that they don't have a lot of exposure to. We'll dive into that in a second. So let's talk about what is a health plan. Like, how does a health plan actually work? If you're a mid-market group, you might not have so much visibility as to what are the foundational pieces inside of a health plan. How does it actually work? So inside of every health plan, no matter if you're self-funded, fully insured, level funded, etc., you've got a plan administrator. In this example, it's United Healthcare. You've got stop loss insurance, otherwise known as reinsurance. Okay, that's the actual insurance component of the health plan. You've got a pharmacy benefit manager who manages the drug supply chain on your behalf. At least that's what they're supposed to be doing. And then you've got a network. Now, when we talk about networks, what you've always been told about networks is it just determines who is actually in your network. Where can our employees go for care to be considered in network? But that's only half the story. To me, the piece that's just as important, if not more important, is that the network actually dictates what your plan pays the providers, right? How much is your plan paying for hospitalizations, surgeries, labs, imaging, and prescription drugs? The network actually dictates these things. It's a contract between your plan and the providers that your employees are seeing in network. Okay, so if we take a step back and we look at how are health insurance dollars, the premiums, quote unquote, being allocated, we can break them into two large buckets. So on one bucket, we've got what are considered fixed costs. And this would include things like plan administration, your stop loss insurance, your broker's compensation. Those are considered fixed costs. And on the other side of the equation, we've got things that are called variable costs, right? So you've got your medical claims and your prescription drug claims, okay? So let's say, if you're a 500,000 life employer, you might, 10% of your total spend might be on fixed costs, 90% might be on variable costs. So if you're going to focus on opportunities, how to reduce your total spend, well, the variable cost is really where most of that is lying, but you have to know how to get there to attack that. More on that in a minute. All right, so one thing that I think some employers may not realize is that they are what's considered experience rated. Even if you're fully insured, if you have over 100 employees, and this may vary state by state, every state has slightly different insurance laws, but generally speaking, if you have over 100 employees, you are what's considered experience rated. Now, what does that mean? That means that the frequency and severity of your claims, how much healthcare your employees use, and the prices that your plan pays for that care will directly impact what your total spend is, what your rates are. Okay, so I want you to think about that. Really, it's not insurance companies that pay for healthcare. It's employers and employees that pay for healthcare. And so we have to think about, when we're thinking about the supply chain, we have to have that perspective that, it's our money, it's the employer's money, and how much we pay for hospitalizations, where our employees go for care, how much they're being overprescribed. These things really do matter. How much waste, fraud, and abuse is occurring in our plan. These things really matter. All right. So let's talk about, how are health insurance rates created? There are things that are pretty much as an employer out of your control. You don't really control how old your employees are. You don't really control what zip codes they live in. You don't really control what sex they are. You've probably been told that you can control their health conditions for the past 20 years by wellness vendors, but the data largely shows that you really don't have a whole lot of effect on that. You can have marginal effects, but given that the average retention of an employee is I think it's 4.2 years. It's tough. It's tough to really to impact that quite directly and measurably. But there are things that you do control. And so healthcare prices, how much your plan pays for, again, hospitalizations, surgeries, labs, imaging, drugs, what you actually pay for those things, you can actually control. Your procurement method, which is going to influence your prices, you actually absolutely can control those things. How much waste, fraud, and abuse is occurring within your plans? You can directly impact the amount of waste, fraud, and abuse that's happening. And then the financing method, whether you are buying stop loss insurance to cap your annual exposure, how much stop loss insurance you buy. There's all kinds of financing mechanisms out there. We're going to save that for another day. Okay, so let's talk about carrier profit centers. How do help public, and we're going to focus on publicly traded health insurers. Um, they've done a really good job of figuring out how to play the game under the Affordable Care Act. And this could be, we're showing United Healthcare here, but this could be any, look up any publicly traded health insurer, and the results are pretty similar. So the boxes in yellow, those are the items, those are the revenue channels that they had before the ACA went into place in around 2011. They made money off of plan administration, the stop loss insurance, the actual insurance component of the health plan, and building out these networks. Those were the profit centers in their business. Since the ACA has inadvertently encouraged these companies to vertically integrate, now they've all bought in pharmacy benefit managers. They're buying physician practices. They're actually buying the supply chain to control the supply chain. And if you listen to their quarterly earnings reports, in many cases, they're making more money off of the supply side than off of the actual insurance side itself. So it's a very different business model. And some of them have started GPOs, group purchasing organizations, to sell supplies to the hospitals. So it's a radically different business model that we had just 15 years ago. So you need to be aware of that as an employer. And so let's talk about some of the downstream effects of what's happened since 2011, since the Affordable Care Act was implemented. A lot of people don't know this, but medical error is actually the third leading cause of death in the United States, according to Johns Hopkins reports in 2018. This came out. So medical error, over 280,000 people a year die from medical error. It's like having a pandemic every year, but nobody really talks about it. So, we're spending a lot more money, but we're not necessarily getting better outcomes. And then, so what is this investment? Has this larger investment in healthcare and benefits had a quantifiable effect and positive effect on the retention rates of employees? Is it fulfilling its mission? Well, on the left-hand side here, we can see that deductibles and premiums have vastly outpaced workers' earnings since 2010. And correlation is not causation, but we can also see that employee quits rates have dramatically risen since 2010 as well. So we got to rethink what we're actually doing here. Okay, so let's take a step back and look at, okay, who wants what in your supply chain? Who actually wants what? Who wants higher healthcare prices? Well, large health systems absolutely want higher healthcare prices. The unit costs of, again, the facility fees, surgeries, labs, imaging, etc. Large brokerage firms, traditional brokerage firms that work for vendors, they get paid by vendors, health insurers, and other vendors inside your supply chain. They benefit from rising healthcare costs. And then very ironically, insurance companies benefit from rising healthcare costs, even though they will publicly fight every 15 months or so in the news with health systems about rising costs. They pretty much always settle, and they both benefit when costs go up. And that's generally because of the medical loss ratio rules inside the Affordable Care Act, which we will not go down that rabbit hole right now. All right. So on the other side, on the demand side, we have, who wants lower healthcare prices? Well, employers want lower healthcare prices, of course. Patients, of course, want lower healthcare prices. Some of the next-gen point solutions, like you may have heard of, companies like Mark Cuban's Cost Plus Pharmacy. There's a million of those out there that have developed business models to help align themselves with their customers. Okay, so there's a whole plethora of next-gen point solutions out there that are, again, aligning themselves with customers to help reduce healthcare prices. And then lastly, I would mention fee-based benefits firms who don't accept compensation from vendors. They are also aligned to help employers reduce costs. So this is, essentially we've got supply and demand here, and we need to know which, whose incentives are what. Okay, so here's the opportunity. We've talked about all the, the challenges, which, some people are aware of to some degree, but maybe didn't know that level of detail. But right now, in the current state of the world, 25% of what employers spend on healthcare, most employers, is considered waste. This is a massive opportunity. This is a $300 billion a year opportunity. It means that on average, $2,500, employers are overpaying for healthcare and benefits by, on average, $2,500 per employee per year. That's $2,500 per employee that should be sitting on corporate bottom lines. Okay, so what are the reasons? We've talked about some of the macro aspects of the dynamics of the employee benefits landscape. But, what are the real opportunities? How do you solve for this problem? Well, the first way you solve for it is to stop paying for healthcare that employees never actually consume. Again, if you have, over 100 employees, you are experience rated. The amount of the frequency and severity of the claims directly impacts what your total spend is going to be. Again, health insurers don't really take on a whole lot of risk. It's your money. So if you're paying for things that never actually got consumed, which happens, if you scrub an explanation of benefit, you're more than likely going to see errors on it. So, we got to keep in mind that the supply side of the equation, large health systems, et cetera, they have a whole army of consultants teaching them how to extract economic rents out of employer health plans. Okay, so stop paying for things that you never actually used. That's one big lever. The second big lever is to stop overpaying for the healthcare your employees do consume. So right here, we're in Orlando, Florida. Healthcare prices vary by over 1,100% in Orlando. I mean, it's just insane. So, for example, you've got employees. If you have, if you're a business here in Orlando, you may have employees going to a hospital for an MRI, and they're being charged. Your plan is being charged $6,000 for that MRI that you can go down the street and get for around $600. So we really need to, if we're going to solve for these problems, we need to understand prices and quality aspects of the care that we're consuming. Okay, so what role do brokers play in all of this? I mean, just about every company in the United States uses a broker in one aspect or another. But why do they use them? Well, the number one thing they expect their broker to do is maximize the return on their benefits investment. Why do they need an outside firm to do that? Well, you know, HR people generally have very little training in benefits, so they don't know the deep they don't have the deep expertise needed to vet and procure the marketplace of solution providers and understand what makes sense, what's going to deliver the best ROI. Finance people, you know, we just don't have a lot of training out there for them, so they don't know these things. So employers heavily rely on their benefits firm to maximize the return on their benefits investment. They also rely on them to keep them compliant, educate their population about their program, and reduce administrative work for their internal teams. But the challenge historically is that brokers get paid by insurance companies, and the federal government classifies this compensation in two different buckets or categories. One is considered direct compensation, and the other is considered indirect compensation. Indirect compensation are the bonuses, overrides that carriers and other solution providers pay to brokers. Okay, so the net effect of this is that brokers actually make more money when your costs go up, not down. So the analogy I always like to use to illustrate the ludicrousy of this business model, the architecture of the industry, is that imagine if your company worked with a CPA who got paid by the IRS instead of you. I mean, you would never do that because you would inevitably end up paying more than you should in taxes. And especially if that CPA got paid a percentage of what you paid in taxes, your tax bill would absolutely go up every year. In fact, we just released an article in the Orlando Business Journal the other day, and the quote we started with was a classic from Charlie Munger, who of course has many classic quotes, but the one we led with was, show me an incentive and I'll show you an outcome. And so it's really applicable to the employee benefit space that the people you're relying on to maximize the return on your investment don't really get paid to do that. And it's not their fault. It's just the architecture of the system. All right. Yeah. And in fact, if they're working on a commission basis, they actually get penalized for reducing your costs. So they make less money when they deliver more value. So you don't really see a whole lot of that. All right, and again, this is a key reason why, from our perspective, the average employer wastes about $2,500 per employee per year on benefits. The impact to employers and finance teams, HR teams is significant. Misaligned vendor incentives create this health insurance inflation, creates lower margins and wages, creates slower growth, lower employee retention, lower productivity, more administrative work, and result in more tactical decision making because internal teams are just stressed. And so we got to break that cycle. So here's a way out. Given the role that benefits firms play in acting as your architect for your program and the general contractor to help you execute on your vision, there's a new trend in this space where there are new types of professional services firms like mine, full disclosure, where we are fee-based benefits consulting firms. And since we're fee-based, what that means is that we don't accept compensation from vendors, no indirect compensation, no bonuses. We don't have to care about which carrier has the biggest bonus program each year. It doesn't matter because we don't get paid for them. And so the beauty of that model is that it allows fee-based firms to give their clients objective, unbiased advice about how to maximize the return on their investment. Okay, this is mission critical. So just to give you an idea of the kinds of services that employers need and what they get and maybe what they don't get between benefits brokers and fee-based firms. Again, benefits consulting. Who are you and what are you trying to do? Right? What are you trying to build? Okay, if we don't know that, if we don't really have a data-driven approach towards understanding that, you really, as a benefits professional, you really can't give effective recommendations, right? It's like trying to build a house without a blueprint. If you just hire a bunch of subcontractors and they start banging on a bunch of nails, it's not going to go well. You're going to build an ugly house. It's going to be expensive. It's going to take forever. It's not going to be good. Benefits procurement. Go out to the marketplace. Help us understand the marketplace of solutions and evaluate what are the right subcontractors to build and execute on our vision. Hugely important process. And then the last piece of this is benefits management. And again, this is where your benefits firm should be acting as a general contractor. And after they've got all the right subs in place, now they're managing the program on an ongoing basis. Which subcontractors are performing well? Which ones are not and maybe need to be replaced, et cetera, et cetera. How are the needs of your business changing? Are you preparing for an exit? Are there levers we can pull to help you prepare for that exit? These are all the things that need to happen. And speaking of procurement, what a lot of employers are surprised to see is that the marketplace is actually much, much bigger than they've been led to believe. So when you actually peel back the onion and show employers what the marketplace actually is, it's huge. I mean, it's vast. It's changing. I mean, these are all solution providers for health plans for the mid-market. And this is just a small sampling. There are many others out there besides these, but this is just one sampling. And if you don't have visibility into the marketplace, you're not going to have nearly enough leverage in negotiations with your current vendors. You're going to miss a lot of opportunities just because you don't have that visibility into the marketplace. All right, so after you get that visibility, okay, what's the end result here? What could this actually look like? Well, if you take this kind of multi-year approach towards your health plan, and you start off by stop paying for things that you don't actually use, and then once you've done that, you've kind of refined that. Then you stop overpaying for the things that you do actually use. The opportunity is big. So for every 100 employees you have on your plan, you can save about $1.9 million over the next 5 years. Okay, so this is material. This is a big opportunity, and I will say, companies that take advantage of this and gain first mover advantage, it's really significant. It can really change the dynamics of their business. They can reinvest in other things. They can reinvest in top line growth opportunities, right? Okay, so the message here is that it's just time to evolve. If any of the employers on the call were at the Health Benefits Nation conference by the Validation Institute in Nashville last week, I think one of the takeaways coming out of that conference is that the future is now. The things that we were kind of dreaming about 7-8 years ago, they're coming to fruition. They're here, and there's really no excuse anymore not to take advantage of them. And I'm sure some of the people on the call have heard about these lawsuits with Johnson & Johnson and Wells Fargo, where employees are actually suing their employers for lack of fiduciary standards. It's because they're still driving this Oldsmobile from 1990 and wasting a lot of money on it, repairing it, when they should be driving a much more efficient and effective vehicle in 2024. So anyway, these things matter. All right, but there's with change, there's always challenges, right? And right now, I mean, I would argue that a lot of employers doing things the way they've been done for a long time are having to change every couple of years anyway. You're probably changing networks. You're probably changing plan designs because you're not sure how to navigate. You're not seeing the opportunities that you want, and so but change is hard. Nobody likes it. So yeah, it requires administrative time and focus. And sometimes whenever you change anything, there's always going to be a couple people in your population that don't like to change. Even if 99% of the population wins, there's always going to be some people that the perception is that they lost something. And then, sometimes you have to re-educate employees. So, these are the challenges. But what are the challenges of not changing? Reduced profit margins, decreased business value, higher turnover, higher organizational stress and a weaker customer experience because of that stress. So, every organization needs to run the cost benefit analysis on what makes the most sense. And that's obviously a role that your benefits firm should be playing and facilitating on your behalf. But these are the things that need to be weighed out. So we told you we're going to keep it snappy here because everyone's got a million other things to do other than talk about benefits. But I hope you guys got value out of this. And if you're interested in getting even more value and interested in how you can what the next steps are to actually pursue these opportunities, I would encourage you just to apply for a complimentary one-on-one benefit strategy session with myself and maybe someone from my team. And so just click on the QR code here and answer 25 questions about your program. And this way we can have a really effective and productive conversation. That's it for me. My name's Donovan Pyle. That's it for me. We'll talk to you soon. Take care. Bye-bye.